Welcome to the Regis College Leadership Series on Health. I'm Karen Voci, and I'm the Executive Director of the Harvard Pilgrim Healthcare Foundation, and it is my distinct pleasure to welcome you here this evening and to serve as your moderator. Harvard Pilgrim is a proud sponsor of this event, and we are thrilled that so many of you are here. Wanted to get just a little bit of an indication of who's in the audience. If you're a nursing student, could you raise your hand, please? Oh, okay. Didn't want to sit up front, did you? Could have missed out on the extra credit. Social work students here? Social workers here? Working nurses? Thank you for everything you do. Anyone else I left out? Other majors? English, social studies, engineering? Health and fitness, sorry. Health and fitness, nutrition here? Great, great. Thank you all for coming. And any other interested community people, we're delighted to have you. Our topic this evening is obesity, a cultural and societal perspective. Childhood and adult obesity is a national problem. The media has kept the issue in the public eye, with research data and diets that are relatively ineffective. This lecture will discuss the increased risk of illness, disability, and death in relation to obesity. Prevention, nutrition, diet, and exercise will be emphasized, including predisposing factors and support systems necessary for successful outcomes. We have a terrific group of presenters and panelists, but before I introduce them, a few housekeeping details. First of all, please turn off your phones and pagers and Blackberries and other personal communications devices. I can tell from up here if you are texting, and I will find you. Any message that you have can wait until this program's over. Life is long. Please feel free to help yourself during the program to coffee. And please, if you don't have the handouts, we have more coming. Amy Anderson is bringing some in, so no one will leave here without the appropriate academic materials. And finally, if you are receiving contact hours, nurses must stay for the full program and complete and submit the evaluation, and you'll receive a certificate then. I'd like to recognize President Mary Jane England of Regis College, who is our partner in this effort, and also Amy Anderson, who organized this evening's program, and she has done a ton of work to make this happen and to put this together. So now I'd like to introduce our panelists. We have Jennifer Sachek, right here to my immediate left, who's the assistant professor at the Friedman School of Nutrition at Tufts University. Jeffrey S. Geller, a director and family practice physician from the Greater Lawrence Family Health Center. We have Deborah J. Cohen, PhD, faculty of sociology at Regis College. And we have Laura Heyman, who's Associate Dean of Research and Professor of Nursing, Health Sciences, University of Massachusetts, Boston. And last but not least, filling in for Susan Fargo at the last minute, and we are eternally grateful to her, is Valerie Bassett, who's Executive Director of the Massachusetts Public Health Association, and she's going to be particularly, she has a particular information for you around state public policy on this topic. So the ground rules are, after you've turned off all your personal communications devices, the first two presenters will have 20 minutes. Then we will go to the panelists, who will provide additional information and some response to the information the presenters have given. We're going to hold the questions till the end, so please think of your questions. We'll have plenty of time for Q&A. It's my job to keep everybody on time. So last but not least, let's get going. And